Happy New Year, or if it's not January, happy whatever day it is for you. If you have landed in this video, you likely are here because you know the benefits of exercise for Parkinson's. Whether you've been diagnosed with Parkinson's or you have a loved one who's been diagnosed with Parkinson's, you've likely heard about all of the supportive research for exercise, and we're going to dive into that here in a second. But I just want to get a show of hands. Maybe you guys can like this video and let me know what resonates. If you have been diagnosed with Parkinson's recently and you're looking to start an exercise program, give me a thumbs up. If you are further along on your Parkinson's journey but have never started an exercise program, or you're looking to restart an exercise program, give me a thumbs up. And if you maybe just were doing really well on your exercise program and something derailed you, whether it was the holidays or an injury or an illness, and you're looking to kind of get back on the wagon but you're not sure where to restart, give me a thumbs up. I just want to know who's out there, who's watching. I see some people in the comments section. Hi Nora, hi Monique, Happy New Year. So happy to see you guys here. So exercise is incredible. I'm a Parkinson's physical therapist. I have seen the magic of exercise, and I want to tell you that if you're tuning in today, and if it's the start of a new year, or if you're watching this on replay and it's the middle of the year, I want to plant a seed in your head and say that exercise is that, magic pill that helps you end this year stronger than you are right now. And a lot of people who are new to exercise are a little bit skeptical when I say that actually you can get stronger and more mobile and more energized down the line with exercise in your Parkinson's plan of attack than you have now. And a lot of people have this fear about Parkinson's because it's progressive and degenerative, and a lot of people think that means over time, no matter what, you're going to go downhill. And I have seen people, and people are watching this video, I see very familiar names and faces out there who have used exercise to get stronger and continue to get stronger despite continuing to have Parkinson's. So if you're here and you love exercise, let me know in the comment section below. I see a lot of people who are in our online exercise program here. Good morning, Jamie. Good morning, Sally. Hi, Dave from West Australia. It's a beautiful day there, I'm sure. Okay, so if you are skeptical of exercise, or you just need a reminder or some gentle encouragement to get back on the exercise wagon, I want to read a really brief mini review of the literature. This came out in July 2018, and it's titled The Effect of Physical Activity in Parkinson's Disease. So when I do my in-person presentations, I always cite this article. So if you have seen me in person, you're going to hear this again. But here's the summary. Physical activity has been known to improve many symptoms in patients with Parkinson's disease, including physical and cognitive capacities. Physical activity also slows the disease process, decreases the pain associated with Parkinson's, prolongs independent mobility, that's things like your gait, your walking, your balance, and your strength. It also improves sleep, mood, and memory, hence improving the overall quality of life. If you're not sold yet, this next part is awesome as well. They say, furthermore, physical activity has the potential to improve the non-motor symptoms like depression, apathy, fatigue, and constipation, and secondary complications of immobility, which means it helps you prevent osteoporosis, prevent cardiovascular disease, specifically in Parkinson's. So, if there was a pill that you could take that would slow the disease process, decrease pain, prolong how long you can be mobile, improve your sleep, your mood, your memory, and also help you with depression, apathy, fatigue, and constipation, wouldn't you line that up every single day? Obviously, I'm passionate about it. I've seen the impact that it can make on someone who has a Parkinson's diagnosis, and I am so passionate about getting you moving. So today, what we're going to do is I'm going to walk you through how to get started, because if you have learned about exercise, you know that Some people talk about cycling and Parkinson's. Some people talk about personal training, or going to a boxing class, or seeing a physical therapist to help you get moving. And sometimes there are so many options out there, it's hard to figure out where to start. And everyone asks me all the time, what's the best exercise for Parkinson's? And I once heard a neurologist speak, and he said, it's the kind that you'll do, and that is partially true, but all of these exercise options will come into play for you if you have a Parkinson's diagnosis. But if they're out of order, if you need, for example, physical therapy in order to thrive with a personal trainer, you need to know that. If you, can skip over physical therapy and just do classes, and use your physical therapy when you need it, you need to know how to make that decision. So today I'm going to give you those tools. I'm going to walk you through where to get started, and our options will be get started with physical therapy, how to know you should get started with a personal trainer, how to know you could start with a group class and skip those two above, or how to know you could start with something like an online exercise program. So tune in and let me know in the comment section below where you plan to start as I start working you guys through these. And I see some people checking in. Nav is here. Exercise is really helping me reduce stiffness and pain. Absolutely. Ron's in here. Happy New Year's from Wisconsin. Hi, Connie. I just have to say hello to all of you who are tuning in this very bright morning. All right, so here's how to know if you should start with physical therapy. Now, let me preface this by saying, if you're new to Invigorate, welcome. I'm Sarah King. I have a doctorate in physical therapy, and I also am specialized in Parkinson's wellness and rehabilitation through a group called the POWER program, which I'll talk more about here in a second. It's an amazing program. Invigorate Physical Therapy is 100% specialized in Parkinson's, specifically empowering you with the tools that you need to take on some more autonomy in your Parkinson's journey, meaning you don't have to go everywhere else for answers. I want to teach you how to take care of yourself because I believe that's the best way to provide healthcare. So that aside, I can speak to physical therapy because I've seen clients one-on-one, I've seen clients online, and here is my best advice if you are starting an exercise program or if you're newly diagnosed. Good morning, Sylvan. Good morning, Jan. If you are newly diagnosed with Parkinson's, if you've never had physical therapy before that's specifically for Parkinson's, if either two of those things are true, you should start by seeing a Parkinson's physical therapist. And here's why. Your Parkinson's physical therapist is going to be your very best advocate as you move forward on your Parkinson's journey. They are trained to be able to see movements that the kind of more layman eye may not be able to see. They can pick out how well your shoulders are turning, your arms are swinging, if you're dragging your toe, and what is contributing to that. And they can look at what's going on with you and help tailor a program specifically for your needs. Not everyone with Parkinson's is the same. In fact, every single person is different. So a Parkinson's physical therapist is specially trained in how to identify symptoms with Parkinson's and also create an exercise program that is specific to you and your needs. And if you are like, well, I've just been diagnosed, I really don't feel like I have any symptoms, do I still need to go to physical therapy? Absolutely, yes, you do, because they can actually help you tailor an exercise program that's specifically for Parkinson's. And that means you can start now focusing on your Parkinson's symptoms even before they emerge to help prolong that amount of time that your symptoms are not noticeable. That's the important part. So if you've never seen a physical therapist for your Parkinson's, or if you're newly diagnosed, go see a physical therapist first. Typically, they'll walk you through between 6 and 12 sessions of exercise and then give you an exercise program to go home and implement yourself, which is where some of these other options may come into play. So if you think that you need to start with physical therapy, give me a thumbs up in the comment section below. And here are some other ways to know that you would qualify for physical therapy first. If it's been more than 1 year since you've seen a Parkinson's physical therapist, it's time to go back. If you've had one fall, or as some people call it, a near miss, one fall or near miss in the last 3 months, or 2 or more falls in the last 6 months. So what that tells me as a physical therapist is that your balance needs to be addressed a little bit more before I send you out into the community to do your own exercise or go to a group fitness class, because you're at a risk for falls if you've had one fall in the last 3 months or 2 or more falls in the last 6 months. If you can't, now listen up, if you can't balance on one foot for more than 5 seconds, you should go see a physical therapist first. That's a very easy screen for fall risk. And if you're wobbly on your feet and you want to try this test, make sure you have someone close by. But if you can stand on one foot for more than 5 seconds, then you're at significantly less likelihood to fall. And what we want to do with everyone is to prevent falls. Prevent falls, prevent falls. We want to get you stronger, obviously, but we need to make sure that you're safe. Okay. And then another reason why you would go to see a physical therapist right now is that in the last 6 months or so, you've noticed you've declined physically because of an illness or an injury. So if you've gotten hurt or sick and you're sitting kind of what we call at baseline is really a lot lower than what you're used to, in the physical therapy world, we call that a functional decline. Functional decline. And if you are sitting lower than your normal baseline, then you qualify for skilled physical therapy, and they can help get you back up to your baseline so that now you can get back into that exercise program that maybe you fell out of. Does that make sense? Give me a thumbs up if that makes sense to you, and if you are probably going to start with physical therapy. We'll make sure that these links are in the description around this video, but if you need a Parkinson's physical therapist, I would encourage you to check out the POWER program. It's PWR, the number 4, and then life, life.org. You can go there and you can search your address, your zip code, whatnot, and you can find a Parkinson's PT in your area. Another good certification is the LSVT, Big and Loud program. Some of you have probably gone through that program as well, and they're at lsvtglobal.com. And we'll make sure these links are around this video. There's a blog post that does accompany this video, and the link is in the description. So if you click on that blog post, you'll be able to get all of these links. Okay, Becky's giving me a thumbs up. Charlotte's in here. Happy New Year. Dave's in here. Pamela. Physical therapy showed me why I was falling and helped me to have an awareness. Beautiful, Pamela. I love to hear that. Obviously, I'm a big fan of physical therapy. So if physical therapy, you don't think that's you, let's go on to the next. Here's how to know you could start with a personal trainer. None of the above applies to you, which means if you don't qualify for physical therapy because you're not a fall risk anymore, or you've already been to physical therapy for Parkinson's, then you may be more appropriate for a personal trainer. If you are going to work with a personal trainer, you're the type of person that wants that one-on-one attention so that they can give you feedback on your form, or you just like working out by yourself with one other person. This is a great place for you to start, is with a personal trainer. And sometimes personal trainers can cost between $50 and $100 per session, depending on where you're at, or more. So if you feel like you have the budget to pay a little bit more to exercise and you want that one-on-one attention, then you can start with a personal trainer. And as we go through these, recognize that your goal is to take your daily dose of exercise 7 days a week, whether just moving in some capacity. It doesn't have to be seeing a personal trainer 7 days a week, but we need you to be moving and taking your daily dose of exercise so that you can do all of those beautiful things that we talked about at the beginning of this video. Feel stronger, more mobile. So you may mix in a personal trainer 2 days a week and then do some of these other options like a group fitness class or an online program a couple other days during the week. And whatever, you've got to kind of find what works for you. So if you mix these together, personal training, group classes, online programs, put that in the comment section below. I'd love to hear what your solution is. Okay. So that's how to know if you should start with a personal trainer. Now, I would encourage you to talk to your personal trainer about getting certified in Parkinson's. The POWER program that certifies therapists, they also certify personal trainers and group fitness instructors in the POWER moves. So if your personal isn't familiar with Parkinson's, you can always refer them to the Invigorate website. We've got some free downloads, including a 7-element checklist, which I'll talk about here in a second, that walks personal trainers through how to get an idea of what someone with a Parkinson's diagnosis needs. So we've got a checklist for them. You could share that with your personal trainer and encourage them to get certified, because then they'll be able to serve more and more people with a Parkinson's diagnosis. So if you are seeing a personal trainer, give me a thumbs up in the comments below. I'm seeing everybody check in. Beautiful. Hi, Barbara. Okay, so we've talked about physical therapy. We've talked about personal training. This next one is to help you decide if you're best suited to start with a group fitness class, specifically for Parkinson's. So a group fitness class could be a lot of things. It could be cycling, it could be boxing, it could be a power moves class, or just some Parkinson's exercise class. If you do any of those things, just give me a thumbs up. And group fitness classes are an amazing resource. And here is how to know that you can start there without kind of skipping over more important things. If you don't qualify for physical therapy, meaning you're not a fall risk, and you've seen a physical therapist in the last year, a group fitness class can be really amazing to help you go from checkup to checkup with your physical therapist. You see physical therapy, you get discharged, you need to do something in the community that is affordable and fun and Parkinson's specific. That's when a group fitness class fits in so well. A lot of people who are watching go to class 1, 2, 3 times a week, maybe even 4. And in a group fitness class, the thing you should be aware of is there's less one-on-one attention. So you get less cues on form. So some people with their Parkinson's have more difficulty figuring out kind of where your body is in space. So having someone in a class give you cues on staying big, for example, and standing tall, you want to make sure that you're exercising the way that you want to train your body to move in the real world. So those cues from group fitness instructors may be fewer and far between. And if you're someone who really likes that or needs that, then consider sprinkling in some one-on-one attention from a personal trainer to make sure that you're exercising in a way that's actually addressing your symptoms. Okay. Another reason why you might start with a group fitness class is you're looking for a more affordable option for exercise. So I know in Austin we have something called Power for Parkinson's, and they offer free exercise classes to people diagnosed with Parkinson's and their care partners. That's a free class. You might have something similar in your community. A nonprofit might lead a group fitness class, but some classes may be between $10, $20 per class, and or there may be some type of membership. But typically, group fitness classes are more affordable. And as I said with personal training, if you're in a group fitness class that's not Parkinson's specific, you can download my 7-element checklist. It's on, I'll put it in the comment section below, but it walks you through the 7 elements that your Parkinson's exercise program should include. One of them is big, powerful movements. It should be specific to your Parkinson's. There's 7 different things that your group fitness class should have. So if it's not specific to Parkinson's, you can make it specific to Parkinson's by downloading the 7 elements and just being aware of those in class. Okay, Monique is in here talking about group Parkinson's classes. Okay, so We've talked about personal training, physical therapy, and group fitness classes. This last option for starting with for your Parkinson's exercise program is something online. So some of you may be scared to death of technology, and I don't blame you. Some of you may be embracing some of this online videos, online exercise options. Invigorate has videos online, obviously, you're watching them. We also have an online exercise program called the Booster Program. That's a formal program, and then some people go and they do exercises that are online just on YouTube. And those are two different categories. So I'm just going to talk about YouTube videos for a second. Give me a thumbs up, or maybe even share your favorite video in the comment section below. But if you go onto YouTube and you just type in Parkinson's exercises, a whole bunch of exercises are going to come up. From 3 minutes hand exercises, that's one of our videos, to 27-minute long full group classes. You can find almost anything on YouTube, and there are some really, really amazing videos. And I think those are best suited for people who need to get some ideas. You can go on the internet and figure out, I need to move my hands more, so I'm going to integrate Sarah's 7 hand exercise video into my daily routine because I want to specifically address my hands. But just watching videos on YouTube may not be the most effective way to start your exercise program because it's not specifically tailored to you, like a physical therapist or a personal trainer would do. And you're not really sure that you're meeting the criteria for the most improvement with your exercise program, which means, are you exercising hard enough? Are you exercising long enough? Are you exercising with the right form? Because not all movement is created equal. So I think YouTube videos are great to work in, to kind of have one specific thing that you're working on, whether it's posture. You could find an exercise video to practice every day. But it's probably not going to construct your entire program. Now, the flip side of that in the online world is actually formal online exercise programs. So the Booster Program, for example, is Invigorate's 5-week Parkinson-specific exercise program. It has a made-for-you schedule. It includes all of the videos. You get weekly check-ins with myself. You get to join our included Booster Tribe private Facebook group. And that offers a little bit more support, and you're getting the full shebang, I guess. You're getting the whole schedule. You're getting everything you need all in one package. And I would prefer to start someone on that if they've already had physical therapy, and you're just looking for something to do while you're traveling or as a kind of boost to kind of mix it up with your group fitness classes, or it can actually be a great place to start as long as you're not, as long as you shouldn't see a physical therapist first. So that program is actually, we're enrolling new students next week, so keep an eye out for that, and we'll share a link in the comment section below if you want to check that out as well. So we have a lot of boosters who are watching, a lot of people who, if you are a current booster and you've taken the program before, we are restarting next week, and you guys don't have to do anything. You're automatically re-enrolled because it's once you join, it's free for life. And then for the rest of you who may be interested in starting it, you can join the newsletter. Go to invigoratept.com and sign up for your free guide. And then I'll send you some information next week when we open those doors. But for right now, here's what I want to know from you. After today, we talked about physical therapy, we talked about personal training, we talked about group fitness classes, and we talked about online videos. In the comment section below, let me know where you think you're going to start. And I encourage you to actually put something in there, because when you take it out of your head, your intention out of your head, and put it onto paper, or in this case, in a comment, you're more committed to doing it. And I am invested in helping